Hi, this is Dr. David Tenner, and we're here at the Goldberg Clinic for chronic disease reversal just outside of Atlanta, Georgia. And today we are joined by Grace Vise, and Grace is going to share her story with us and with you, our audience. It's a very interesting story. So I'm just going to turn it over to Grace. Grace, what originally brought you in to see us? What have you been diagnosed with? And more importantly, what had been your experience medically and the treatments that were provided to you?
Well, I was diagnosed with rheumatoid arthritis about 2 years ago, and I had just started out with a little bit of swelling in my foot, and then it eventually, within a 4-month period, the swelling had traveled from that one foot to my other foot, to my shoulder, to my hands, to my wrist, and so systemically I was basically swollen from head to toe. And so right after I was diagnosed, it probably took me 6 months before I was diagnosed. And then right after I was diagnosed, they started me on methotrexate. And I took methotrexate for probably about 6 months and was seeing no effects whatsoever except for me losing my hair and being, nauseated and tired all the time. And my joints were still swollen all the time as well. So once I moved to Atlanta, they put me on Remicade, and I had to take the infusions because I'm definitely afraid of needles, and so it was better for me not to do the injections, but to do the infusions. And those would take about 2.5 to 3 hours, and I have to go in, I had to step it up, but I basically ended up going every 6 to 8 weeks for these infusions.
Grace, I'm just going to interrupt. Yeah, Grace's the scenarios is very common. We see a lot of patients with autoimmune issues, including things like rheumatoid arthritis. Symptoms start spreading. They see their rheumatologist. They're generally prescribed any one of a few medications. Sometimes starts out with things like methotrexate, sometimes Plaquenil, and other medications. Things generally then progress to heavier drugs. Things like prednisone and in your case Remicade. And Grace was actually just telling me about the situation that had occurred with Remicade. Just tell us about what happened when you had started to get those infusions.
Sure. So I was probably on my 6th infusion when probably 20 minutes into it, I started to feel hot, and then my head started to itch. And so, I kind of tried to tough it out. And then my whole body just started to tingle, and I felt heat kind of everywhere. And I finally called the nurse, and I just told her I didn't feel very well. And then I looked down, and I had started to get hives kind of up and down my arm. I had another one, I think, on my other arm that was starting. And I had one, I think, along like my face. And that was when they stopped the IV altogether and gave me some steroids, I believe, just injected some steroids, and I had to stop.
So the plot thickens here.
Mm-hmm.
So you start with methotrexate, your hair starts falling out, you have side effects from that drug. So they move you on to Remicade, and the Remicade starts producing side effects, and so they now move you on to prednisone.
Right.
All the more, wow, what's happening with your health?
Oh, it never got better. The prednisone would help for a brief period of time, however long I was on it, and then gradually it would come back, usually even worse after I took the steroids.
And that's the typical, what Dr. Goldberg would call the enjoy now and then pay later
right.
kind of approach, which is exactly what happened with you. Now, this isn't the first time we've heard this scenario. I actually just showed Grace some pictures of another patient we had worked with who had taken a similar drug, a drug called Enbrel, which is also a TNF alpha blocker in the same family as Remicade. And she didn't break out with hives, but she broke out with a huge skin rash. And actually, I'm going to show you on the screen here just a couple pictures of those. Again, when we see patients with these kinds of problems, they come in on some very toxic medications. We're concerned because the causes of their problem, for one thing, are not being addressed, and then also when they take these medications, the potential for side effects is very high. So Grace came to see us back in February of this year, it's 2015, And she decided she wanted to take another course, one not so much focused on treating symptoms or her condition, but rather one to try to figure out what's actually happening, what's causing this problem, and then to try to figure out what we can do to then get her healthy. One of the things that we really focused on with Grace is what was going on down in her GI tract. Most of the immune cells are actually located in the gastrointestinal system, and so patients with autoimmune issues and allergies as well, like Grace has, will also have digestive issues that are playing a significant role in the disease process. So we've been working with Grace now for about 4 months pretty intensively. She's been working very hard. And Grace is now drug-free, right? So she's not on any medications. And what kind of changes and positive improvements have you noticed during that time?
Oh, I mean, it's amazing how I went from really not being able to walk up my stairs or play with my kids to, being able to walk up the stairs now. I mean, I still have a little bit of inflammation, but it's just so much better. I can actually open like my toothpaste and I can, open the milk jars. I wasn't able to do anything like that at all, which I'm able to do now.
And that was while you were taking drugs.
Mm-hmm.
Now
Yeah,
you're drug-free.
just to be able to function. And quite honestly, I mean, just one of the big stress relievers for me to be, drug-free is I would sit there in those infusion chairs and just be so stressed out because I kind of knew that this it didn't feel right. I knew that the drugs were so toxic, and whenever you have black box things going into your body, it was just such a big source of stress for me. And just to be able to not have to worry about drugs. I mean, I don't even take any Advil or Motrin or anything like that at all either anymore. And it's just such a burden lifted off of me now.
And that's also something that's going to help you get healthy.
Yeah.
Because all that stress that you were experiencing is going to exacerbate or irritate the immune system and further set off your joints, becoming a vicious cycle. So we haven't completed our work with Grace yet. There's still a lot of work to be done, but we're very encouraged with the progress after just a short period of time and after all the drugs she had been taking previously. She's really come a long way. We're going to continue to be diligent in working with her and creating the right conditions for her body to continue to evolve into good health. And as long as she's going to be consistent with us and continue to work hard, we're hopeful that the improvements will continue to be made over time. Is there anything else you'd like to share with our audience about your experience with us here?
Oh, I mean, I would just say, it is a lot of work. It's hard to, be with your family who doesn't necessarily have to follow certain dietary rules or, whatever, but it has been so worth it to, kind of sacrifice some of the things that I enjoy or thought I enjoyed. Because now, I mean, the time I get to spend with my kids, actually playing with them as opposed to being like a bystander, because that's what I was just on the sidelines all the time. But being able to actually participate in things now with my family, you just can't put a price on it. It's been amazing.